So what is diaphragmatic breathing? So diaphragmatic breathing, or 360 breathing as I like to call it, is 360 degrees of expansion of your torso, your rib cage. Okay, so this balloon model is a good way to look at it. So your core is not just made up of those six-pack abs that you might think of. Your core is actually made up of your diaphragm at the top, the main breathing muscle, your abdominals, which includes all of the abdominal layers, from the deepest layer, the transverse abdominis, your obliques, and those six-pack muscles, the rectus abdominis. All of your abdominals. Your pelvic floor sits like a hammock at the bottom of your core. So think of it as between those sit bones, both side to side and front to back. Those muscles support your organs, they help with continence, and they are also postural muscles and anticipatory. So they kind of work before you do a movement, or they should. Then you also have your low back stabilizers on your back. So this whole thing makes up your core canister. And we need all of these players to be working and coordinating together in order to have proper function of your core and to be able to improve your core stability and strength. If all of these players are not working together properly, or if you're not able to activate them, meaning turn them on, so send that signal from your brain to these different muscles to turn on and work, if you can't find them, we can't strengthen them. So first we have to make sure that they're all turned on when they're supposed to be turned on and working together before we can then build core stability. So the way we like to start with this is diaphragmatic or 360 breathing. So your rib cage here, we need it to expand as you inhale. So when you inhale, you want to think of expanding your rib cage out to the sides. That's often the most part that is missed. People's rib cages will go forward, but they won't come to the side, and we need them to go out to the side. So I like to use hands on the rib cage. When you inhale, you're going to inhale through the nose. Think of expanding your rib cage to the sides while also sending your breath down into the pelvic floor. You should feel those pelvic floor muscles kind of release and relax. So everything on the inhale is just focused on relaxing. So I'm going to demonstrate here in this position first. So inhale, and then exhale. As you exhale through your mouth, your ribs will come back down and in. You also want to think of gently, very gently, squeezing those pelvic floor muscles and lifting up. So visualization is really good here. So think of, it's kind of silly, but think of there's a blueberry that you're trying to squeeze with your pelvic floor muscles, like you were trying to stop urine or gas, trying to squeeze and then lift that blueberry gently up. And then as you inhale, you're thinking of letting that go. So letting it out as you relax. So inhale, expand, send that breath out to the sides and down. As you exhale, you can bring your ribs down and in as you think of lifting that pelvic floor. And the last piece is getting those deep abdominals. So you have your two hip bones here. Imagine there's a string between the two hip bones, and you want to try to pull that string closer together. That's going to get those deep abdominals. You can also feel that right inside your hip bones if you put your fingers there. So one of the first places I like to start is on your back. So I'm going to just demonstrate a couple breaths on your back and talk about the coordination of everything. So I'm going to do a couple here. So inhale, exhale, inhale, everything relaxes. Exhale, from the bottom up, pelvic floor squeezes and lifts. Think of pulling the hip bones together. Ribs come down and in on that exhale. So inhale, out into the sides, down into the pelvic floor. Exhale, pelvic floor lifts, lower abs contract, ribs come down and in. So that is diaphragmatic or 360 breathing. If you can do this daily, especially in the early postpartum period, it is very safe and effective to begin early postpartum to start reconnecting to those deepest layers so we can get everything working together properly so that we can then build on that and strengthen your core.